Most states are reporting the anthrax disease outbreak following the announcement by the Federal Ministry of Agriculture and the Nigerian Center for Disease Control and Prevention. What does this mean for Nigeria and how concerned should we be? This is our focus today on sound health. Good evening, I am Olasunbo Mudupe. The conversation begins in the moment. Please stay tuned.
Every year, World Population Day is observed on the 11th of July, which aims to draw attention to the various challenges posed by population growth. World Population Day was established by the United Nations in 1989, inspired by the significance of the world's population reaching 5 million people on July 1987. The theme for this year's World Population Day is Unleashing the Power of Gender Equality, uplifting the voices of women and girls to unlock our world's infinite possibilities. At present, the population of the whole world is more than 8 billion, and due to this, the earth and the environment are being badly affected.
It is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Yahaya Disu, Head Risk Communications, Nigerian Center for Disease Control and Prevention. And he is going to tell us what the anthrax disease outbreak is all about. Good evening, Dr. Disu, and thanks for always joining us.
Good evening, Olasunbo. Thank you for inviting me.
All right, Dr. Disu, take us through what anthrax disease is all about. Most states are recording this outbreak. Should we be concerned, and what should we be doing now? Tell us what this disease is all about.
Well, anthrax is a bacterial disease, and that is caused by a bacterial disease called Bacillus Anthracis. These organisms can be found in the soil or in the environment, and they can stay because they form spores, and we can make it to stay for a very long time in the environment. So we stand harsh condition. So when the right conditions are made available, and then it can become effective, it can get into animals like cattle, sheep, and similar species. And then once this happens, there's also the risk of human transmission. So right now, like Federal Ministry of Agriculture and Rural Development confirmed the diagnosis in animal in Niger State over a week ago. And we also have human exposure because from where these animals are, where this disease was confirmed, there are also human beings, farm workers, livestock owners, operators who are working in this farm who have been exposed. So, and then the Federal Ministry of Agriculture and Rural Development has been proactive in ensuring that there is no further transmission among the animals, and then to make sure that they identify sick animals and then take the necessary biosecurity measures to prevent transmission to humans. And then we're working with them through the state government and the state ministry of health as well, to ensure that the humans that are exposed are identified and being followed up, given the necessary treatment to make sure that they don't suffer severe manifestation of the disease in cases. And when they pick the symptoms in animals, they quickly report to the veterinary authorities in their zones so that the appropriate actions can be done. Likewise, for humans too, we are working together with Federal Ministry of Outbreak to ensure that there is synergy in prevention and response efforts. So, anthrax has symptoms in humans. In case humans get this disease, like now depends on the type of anthrax, and that is informed by how it is transmitted from animals to humans, or either from the environment to humans. Like if it is through the skin, and which is the most common type, because if the spores from the contaminated environment get exposed to our skin, and then we can also have what we call cutaneous anthrax. And then it starts in blisters, and later it becomes ulcerated and then that is then sometimes it can become painful. So you can have that, then it become a cost over time. So in the painful, the painful may be itchy, and then once you have that, it's good that you quickly report to the appropriate authorities for them to start investigation and put necessary measures in place. And then again, people be inhaled through the respiratory system. For instance, if when the environment is contaminated, let's say the animal products that is infected, maybe the skin or something, and then while they are processing, and somebody inhales the spot, then you can have inhalation of anthrax that will fill the chest. And then the other one is through ingestion by consuming it through contaminated food or water. So then it will affect our gastrointestinal system. So all these forms can also become generalized, as in, apart from the parts it affects, it can also spread around the body and cause severe form of disease. So you usually have the symptoms like fever, weakness, and you also have appetites, just like in any other infection. And then later, it can progress to severe form that can manifest as bleeding from the orifices also, just like what we have in animals. So although bleeding is more common in animals, and that's what you see more in animals, and that's what really make people to report this disease. So, well, in animals, because all of us need to be vigilant about the animals around us, in case we see animals that are sick or die suddenly, that we don't need the cause of death, then it's advisable that we report to the veterinary authorities. All the health authorities will help us contact these veterinary authorities in case we don't know them. So it's important that we don't just eat such animals, and we're very careful. Particularly people who work in Bacillus, our police from Ministry of Outbreak at federal and state level have also been doing campaign to talk to Bacillus workers and livestock operators to ensure that they identify these signs and symptoms in the animals and report early medicine and then what protective measures.
All right, Dr. Disu. All right, from your explanation now, it is obvious that this disease, it is highly contagious. Before we look at other symptoms, you said when infected with this disease, we'll experience ulcers, skin ulcers. Before it gets to skin ulcers, that means it must have infiltrated the system, the person's system. What are the basic symptoms one should look out for, so we don't have to wait till it gets to skin ulcer, till we rush someone to the hospital?
Okay, let me clarify something. There are three means by which this bacteria can get into the human body. Mm-hmm. One of them is through the skin. When it comes through the skin, you have the skin ulcers.
Okay.
Right? Yes. It's not that when you ingest it, like later, is the later manifestation it gets to the no.
All right.
It is direct contact with skin. It results in skin ulcer. Then the one that affects just the respiratory system is as a result of inhalation of the spores. Like for instance, now if the skin product, the animal product, and it's contaminated, and while processing it, is pulse and when he inhales it, and then one could also be affected that way. And then the last one is ingestion through contaminated food or water. So, and that's like each of these it can become spread to the rest of the body or severe form of infection, and can also result in death. Just like what we reported after Ghana in June. So what we do is visualize and show animals in the seaport that just don't know the cause of their deaths. And then or even when I mean the way the people to go, which people on top of the about our time you are familiar with this, we don't know the how the need is like so that the system usual. That is not the need for the cells of the body. And it's also very important that our health workers also work out for these kinds of symptoms in case infectious symptoms in hospital, fever, headache. The community also history of contact with other animals?
There are two things involved: history of exposure, and then the signs and symptoms that may be characteristic or general symptoms. So once one gets to the hospital, the healthcare workers with the high index of suspicion will be able to, and then once they see those symptoms, and link the person to possible exposure, whether the person is in contact with sick animals or they have consumed any animal that has a history of, don't know what caused the death of the animal or all areas where there has been outbreak of this anthrax. Maybe there is an exposure, the person works in the farm. So those are things that the healthcare workers will put together that will make them suspect that this will be anthrax. And what they do is they notify the health authorities for them to follow up with investigations to get the cause of the sample.
So Disu, the major carrier of this disease is animal, the cow, the deer, the what we call the game meat or the bush meat. Here on a daily basis we eat meat. Nigerians cannot do without meat. Majority of Nigerians eat meat on a daily basis. We've heard people say once I boil, once I smoke, fry and all that, I've conquered the anthrax disease. Is this truly possible?
Well, if you eat contaminated food generally, because this is a disease that affects animal, cattle, sheep, and then if you eat the meat, then you're also at risk of getting a meat that is contaminated by the organism. So one of the ways to also avoid to reduce the risk is by cooking thoroughly to make sure that we kill the germs in the food that we feel will be contaminated. But for anthrax, because when anthrax gets to the environment, it forms spores, and it transforms into a form that will enable it to survive a harsh condition in the environment for a very long time. So if it's the spores that contaminate your food, then cooking may not have any effect on it. So that's why we need thorough environmental sanitation and personal hygiene, and to ensure that, and in the food hygiene, to ensure that we don't just eat anything. And if there's anything that we suspect, then we'll report to the appropriate authority. If it's animals, it's the veterinary authority. If it's the environment that we think is contaminated, then the environmental health authorities, we have them in our local government, take up. Then if it is humans that we think, oh, I might have been exposed and this thing comes, then I report to the health facility or call the emergency hotline of the State Ministry of Health or the 6232 for the NC. That's Nigeria Center for Disease Control and Prevention.
Okay, we know there's a joint resources put together by the Nigerian Center for Disease Control and Prevention and the Federal Ministry of Agriculture, which is vaccination. Apart from vaccination, are there other forms of treatment? Is this disease treatable?
Well, it's a bacterial infection like infectious. It's treatable. There are types of antibiotics, but the healthcare workers will prescribe the appropriate antibiotics to treat it. So that's why we encourage people to report early when they show signs and symptoms.
Dr. Yahaya Disu, Head Risk Communications, Nigerian Center for Disease Control and Prevention. Thank you so much for your thoughts on anthrax disease.
Thank you for having me.
That has been Dr. Yahaya Disu, Head Risk Communications, Nigerian Center for Disease Control, on how to prevent the disease from breaking out in other parts of Nigeria. Sound Health continues with trending health report from around the world. Please stay tuned. Still Sound Health on Lagos Television. We now take a look at hepatitis as the world observed World Hepatitis Day. Alright, this is all we have time for today on Sound Health. Hope you've learned one or two things about the anthrax disease. Report symptoms early enough to the nearest health center. Prevention, they say, is better than cure. Do away with contaminated meat or sick animals. For comments and inquiries, please send SMS to 0035826003 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.